Hi everyone, Dr. Pat Vickers here. I promised I would produce a video on the censorship that's been going on with me and the Gerson therapy. For the roughly 40,000 of you who follow us on our various social media platforms, you may or may not have noticed over the last 9-10 months we've pretty much gone incognito. We haven't really posted much, if anything, on our social media platforms. And there's a reason for this. Back in August or September, I think it was September of last year, there were very disturbing developments going on in the realm of natural medicine. I will never forget it. It was a Saturday. I was actually just sitting on my couch at home. I'd opened up my phone, was looking at some of the news headlines, and one of the main headlines on Google and Yahoo was YouTube will be coming out with new international public policy to protect the public from medical fraud. As soon as I saw that headline, I immediately knew that I would somehow be impacted by that new public policy. Only I didn't know how dramatically I would be impacted by that new public policy. And sure enough, on Monday, 2 days later, 15 years of interviews, podcasts, lectures, classes that I had given and put on video and loaded up to YouTube, roughly about 125 different videos. 70% of those were taken down overnight. And so I was a little bit dumbfounded and shocked that, that many came down so quickly, and I couldn't quite understand why, but I went and posted it on Facebook, and a viewer kindly sent me the official publicly published guidelines for medical fraud that YouTube had laid out that they would now begin censoring. And lo and behold, if you scroll down and read everything that they were censoring, unilaterally, with the exception of one other named therapy, they called out specifically the Gerson therapy. Of all the therapies in the world, they only called out two: the Gerson therapy and the Hoxsey therapy. None of the other clinics, none of the other therapies were on their list, with the exception of individual kinds of treatments like IV vitamin C, MMS, IV chelation. They even named coffee enemas, which, as you know, Dr. Gerson made famous. And so I was absolutely shocked that of all the therapies in the world, they only called out the Gerson therapy and the Hoxsey therapy. Why? Well, simple. Because all these other therapies, as natural as they are, or, fall outside the realm of conventional medicine, while I think that's great, they do not have the long-term or long history of being able to reverse advanced terminal disease like the Gerson therapy does. And we're not only reversing advanced cancer, we're reversing virtually every single degenerative disease. So clearly, they saw the Gerson therapy as the biggest threat to the system. And it wasn't like some CEO at YouTube woke up one day and says, we need to protect the public from medical fraud, and he laid out, what he believed was medical fraud. Of course not. And we're going to be attaching those official public policies of YouTube with this video, so you can see for yourself what YouTube officially put out in the public realm. And so, of course, it wasn't just YouTube working unilaterally. It was them working in conjunction with the World Health Organization and the medical industrial complex as we know it. And they even say so in the public policy, that they are doing this based on the World Health Organization guidelines of what the World Health Organization, who's owned by who? Our good friend Bill Gates. And who is YouTube owned by? Our good friend Google. And so, lo and behold, overnight, by default, because of being the face of the Gerson therapy, I became one of the most censored doctors in the world at this point. And just to give you a practical idea of what that means, since then, I've had numerous people who've done podcasts with me call me up and say that our podcast was taken down off of YouTube. Even worse, a very powerful person from Zimbabwe who asked me to come to Zimbabwe and treat them and their family, was to wire me money from Zimbabwe or, to the United States. But because Zimbabwe has sanctions against it, they can't wire money from Zimbabwe. So they use their banks in England to wire funds around the world to whoever they need to wire funds to. So this person was going to wire funds to me via their bank in London, HSBC Bank. So they went to wire funds to me. They literally had to spend 4 hours on the phone with HSBC Bank in London because HSBC refused to wire money from their account to me because I was in their system, apparently, as a criminal. I was already in the system. And they refused. And this is a person who had a lot of money in that bank. And so that bank, you would think, would be like, oh, this is a pretty prominent client. I don't think we should be arguing with them. We'll just go ahead and wire the funds. And it wasn't like they were wiring me $1 million, right? Of course not. But regardless, they sat there for 4 hours arguing with HSBC Bank until somebody higher up finally just said, okay, we'll do it. But this is how far it's gone now. Now, this isn't the first time the Gerson therapy has been censored, right? This has been going on since 1946 when Dr. Gerson testified before the United States Senate. They've always seen the Gerson therapy as fraudulent, quackery, but they've always turned a blind eye to it and have never really taken action against it. But now they've taken action. And now that they've taken action against it and now have publicly determined it and called it out as medical fraud, now they're going to criminalize it. And once they criminalize it, they can persecute it and prosecute it. And so this is just the beginning. And from this point on, it's only going to get worse. They can shut down bank accounts, throw us in jail. God only knows what they're going to do as we move forward and they try to crush natural medicine, but most importantly and specifically, the Gerson therapy, as you will see in the publicly published guidelines that we're going to attach to this video. So, with that said, we preemptively decided to shut down our clinical operations. We just felt like, well, first of all, our inquiries and our hits on our website dramatically decreased. And year over year from then until now, our hits on our website have probably gone down now 70, 80%. And so we preemptively decided to shut down our clinical operations. One, because with that kind of traffic being lost due to the censorship, financially over time, we wouldn't be able to keep up because to run a clinic costs a lot of money. And so, but secondly, and more importantly, was we saw the writing on the wall. And that writing on the wall was that, as I said, now that they have called it out as medical fraud and now taken action against it, they're going to criminalize it and persecute it and prosecute it down the road. That's coming. So we preemptively decided to shut down all clinical operations. All is not lost. We have now moved to doing everything remotely, more underground, remote, with a 3-month home program that we have people on where we send everything they need for 3 months and we counsel them online, live video via Zoom on how to carry out our advanced therapy protocol at home, which, actually has been a blessing in disguise for many. One, because a lot of people couldn't afford to come to a clinic. I mean, had you come to, the clinic, you would have had to pay $20,000 to $30,000 for a 2 to 3 week stay. And that was, based on how much, extra therapies and stuff you would receive. But, it wasn't cheap to run a clinic, and therefore we had to charge to accommodate for that. Our 3-month home program is exponentially cheaper than that. It's like $5,000 for the entire 3-month home program. And so it's a blessing in disguise. Also, things are getting a little crazy in Mexico. If you haven't seen in the headlines, well, things are getting crazy around the entire world. But in Mexico, it's getting a little more dodgy than it has been in the past. So, We just felt that by preemptively shutting down, our clinical operations, that would serve everyone better. But it is a tragedy. I mean, it's a tragedy, first of all, that we can't even practice in this country, the United States, because of the laws laid out by our politicians who are under the influence of the pharmaceutical and the medical industry. But nevertheless, it's going to get worse. I mean, this is just the beginning. So this is why we've remained really low key. We haven't really been posting much. We're really just trying to navigate how are we going to go through and adjust to these current conditions, because under normal circumstances, I might have hired a PR firm, to help me get out on podcasts and stuff. And I've done that a couple times previously. But a lot of these people that have podcasts, they're dependent on YouTube for their content. And so to go and pay someone $20,000, $30,000 to get us out on podcasts for a year, only to have them get taken down, but not just for our sake, but for the podcast person doing the podcast. If those videos get taken down, they can get strikes that YouTube gives them. And after 3 strikes, I think they're deplatformed. And so we are putting them at risk. So this is the situation that we're in. And it's nothing new. As I mentioned, Dr. Gerson, up until his death in 1959, was the most censored doctor in the world. And there are, at least 6 or 7 occasions since his death in 1959 where you had the opportunity to hear about Dr. Gerson on a world stage, but it was kept from you in the editorial rooms. They edited out completely, and you weren't able to hear about Dr. Max Gerson and his absolutely incredible, powerful therapy that to this day, nothing can rival it. This is why 8 movies have chronicled Dr. Gerson's work. No other therapy can remotely boast but one, if that. 8 movies have chronicled Dr. Gerson's work. Why? Because there's no other therapy in the history of medicine that's able to do what the Gerson therapy is able to do, which is again why they singled it out as medical fraud. And when you look at that list, you'll see it. Of the thousands of other natural therapies that are out there, they only chose 1, the Gerson therapy, and 2, the Hoxsey therapy. And so this is the predicament that we're in. This is the predicament that me and my colleagues are in. We can't get it out to the public the way we used to be able to get it out. And again, this isn't the first time. Let me give you a classic example. Here's a book. This is an epic book if you can ever read it. It's called The American Experience of Dr. Max Gerson, Censored for Curing Cancer. One of the best books I've ever read. In that book, it was written in 1956 by a New York Times journalist who was cleared by his editor to write a story exposing Dr. Gerson as a fraud. And anybody who does any kind of research on the Gerson therapy should clearly come to the immediate conclusion that Dr. Gerson was reversing virtually every single degenerative disease, and he was clearly a threat to the system as you and I know it. And so this book, he ends up turning his story and writing The American Experience of Dr. Max Gerson, Censored for Curing Cancer. And in this book is Dr. Gerson's word-for-word testimony before the United States Senate in 1946 when he was called to testify on his cancer treatment. It's document number 8947 in the United States Archives, just off of Capitol Mall in Washington, D.C. You can walk in to the United States Archives building, ask for document number 8947, and it's probably collecting a foot of dust under the rest of all the other archives in there. But that is Dr. Gerson's word-for-word testimony in 1946. What happened? What happened in 1946? Well, he was called to testify because the Pepper-Neely anti-cancer bill had come to the floor of the United States Senate. It was designed to appropriate $100 million in funding to anyone who could show promise in the realm of cancer research. Well, they got word that there's this guy on Park Avenue in Manhattan reversing virtually every single degenerative disease, but most notably cancer, and they invited him to testify. So from July 1st through the 3rd, 1946, Gerson sat before Senator Claude Pepper, Senator Neely from, I think, New Hampshire, and talked to them and the rest of the Senate about how he was reversing advanced disease. So shocked was everybody behind those Senate chambers door that Senator Claude Pepper himself, who to this day remains the longest serving congressman and or senator in U.S. history, out of Florida. He said Dr. Gerson dedicated his life to the mastery of this scourge of cancer, and all should honor his great work. And so here we are, almost 80 years later, 65 years after Dr. Gerson's death, and he still remains the most censored doctor in the history of medicine. Only now it's just been taken to a new level. What happened? Well, Dr. Gerson was supposed to give his interview to the international press after he testified. Now, understand he wasn't just testifying about his ability to reverse cancer. He was talking about all the things that were causing cancer back then, which includes today. The agricultural industry, the food and chemicals, the pesticides, big oil, all the pollution. He was talking about all these things. And of course, those were all the big conglomerates, right, that were feeding the campaigns and the pockets of these politicians. And so when Dr. Gerson was testifying before the United States Senate, you can rest assured a big red flag went up through all of Washington. And so he's whisked away to the international press room to give his interview to the international press. They were never ushered into the international press room. They were whisked away to another room, and an impromptu party was thrown on their behalf, and they never got the opportunity to interview Dr. Max Gerson. Luckily, there was a man present at that testimony named Raymond Graham Swing. Raymond Graham Swing. Now, who was Raymond Graham Swing? Well, back in 1946, you didn't have TVs. If you wanted to listen to the news every night, you gathered around your radio. You had ABC, NBC, and CBS radio, right? And so each had their own individual anchors, and it was at 7 o'clock every night that you listened to the news on one of those three stations. Well, Raymond Graham Swing, who'd been working for ABC News Radio for 30 years, was the anchor person that you tuned into every single night for 1 hour to listen to the news. He was at Gerson's testimony. He went on his radio news broadcast that night and he said, "Folks, please forgive me." He said this to the entire world, the entire nation, and it was broadcast around the world to various locations as well. He said, "Please forgive me if I don't have my morals correct in talking about all these other stories that would have been top news headlines for that evening. But what I heard behind Senate chambers doors is absolutely shocking." And he went on to talk about, for 45 minutes out of that hour, he went on to talk about how the cure for cancer had been found. And for 9 hours straight at the Manhattan switchboards of ABC News Radio, for 9 hours straight after that broadcast, people from all over the world were calling up to find out where to find this treatment for cancer and all these other diseases. So Raymond Graham Swing had been working for ABC News Radio for 30 years at that point. 2 weeks later, Raymond Graham Swing was fired from his job at ABC News Radio. Why? Because he'd suddenly become a threat to the establishment from what he'd done and now what he knew. And so this is where we're at. And again, the book is called The American Experience of Dr. Max Gerson, Censored for Curing Cancer. Unbelievable book. You can read that word-for-word testimony before the United States Senate. Well, fast forward 80 years later, and here we are again. Only now, the stakes have been upped. The ante has been upped. And this is the predicament we're in. And so, I guess I'm asking for any of you out there who has the ability to draw people to you for big events. I don't know if it's a church. I don't know, if it's whatever, if any capacity you have to draw people to you, please let me know. Let's put on an event somewhere. If I have to fly somewhere to put on a large event, I'll do it. If you have access to any of these other big podcasters who don't depend on YouTube because they have such a huge following, like Joe Rogan, Russell Brand, Tucker Carlson, Glenn Beck, all of these guys that are out there trying to expose the truth, who aren't dependent on, you know, what a lot of these other podcasters are dependent on, which is getting their, you know, their podcasts out on YouTube. Please let me know if there's any way that I can get into some of these, you know, different podcasters who may be interested in taking on this story, because it truly is one of the greatest tragedies in certainly American medical history, if not world medical history, the story of Dr. Max Gerson. You know, I lived with Charlotte Gerson back in 1999. And so I lived with her for 2 months, where in her father's garage, she had all his handwritten files of all his active patients from 1910 to 1959 when he died. You know, I'm one of a handful of people remaining who've ever laid their hands on those files. But every morning, Charlotte and I would get up and we'd eat breakfast alone together at her table. And we would just talk. You know, I mean, she gave me so much anecdotal stuff about her father. But the one thing that really stuck out to me was when one breakfast she just said, you know, when my father died when he was 79 or 80 years old in 1959, and suddenly, by the way, she said he was depressed. She said he was ready to go, to be perfectly honest with you. And it's understandable. You know, it's really understandable what Dr. Gerson suffered based on what he knew was something very few in history have suffered. His ability to reverse advanced terminal disease, his desire to want to help a sick and dying humanity, and he became the most ridiculed, ostracized, and censored human being in the United States and around the world. He was one of the most published doctors in the world up until 1946 when he testified before the United States Senate. After that testimony, he couldn't publish anything in major medical journals around the world. He became completely censored. And so when she told me that, you know, I thought, you know, that's really tragic that a man of that stature, that genius, has to suffer so much for what he knew and what he was capable of doing, and that he died completely depressed. And so I have to be honest, in the last 9 to 10 months, and you can probably even see it in my eyes, it's been the most stressful thing I've ever had to deal with. To be able to publicly talk about your passion, your love, what you do, Dr. Gerson's legacy, and to have you muzzled and silenced by the powers that be, YouTube, Google, the World Health Organization, and know the direction that they're taking this. It's been quite humbling and quite disturbing at the same time. And, you know, that spirit that Dr. Gerson had to endure of all that censorship, which is really just evil, you can understand why he suffered like he did. And by default, as someone who's, you know, been given the gift of carrying on his legacy, I have to say that this is probably one of the toughest things that I've ever had to deal with. And so I guess my plea again to you is, if there's any way that you can help me get Dr. Gerson's name and his story out to the general public through some of these other social media platforms and podcasters, or if you're someone who has the ability to gather large crowds of people to you, please feel free to private message me, contact me off of our website, gersonclinic.com. And you know, again, we're still offering the 3-month home program. We still have our Gerson Clinic store where you can go and get all your Gerson therapy needs that, you know, that go in conjunction with the Gerson therapy. So those things are still in existence. But for us now to be able to get this out in the ways that we're able to get it out, we can't do it anymore unless we have people behind us who can lead us to others who have larger followings and, you know, aren't so dependent on the system as you and I are accustomed to getting our information from. So thank you for your time. I'm going to close with reading Dr. Albert Schweitzer's eulogy to Dr. Max Gerson upon hearing that Dr. Gerson had passed away. Dr. Albert Schweitzer, Nobel Peace Prize winner, Dr. Albert Schweitzer, who 8 years before he won the Nobel Prize had severely advanced diabetes. Dr. Gerson cured him in 6 weeks. Schweitzer's wife Helena, when they had just had a daughter together, Raina was just a small girl at the time. Schweitzer's wife Helena had terminal tuberculosis. She was going to die within 6 months. Dr. Gerson completely cured her. When little Raina was 4 years old, she had an undecipherable skin condition. Dr. Gerson completely cured it. And so Albert Schweitzer was Dr. Gerson's best friend. And you can imagine the unbelievable gratitude and respect that Schweitzer had for Dr. Gerson. In fact, when I lived with Charlotte, there were 2 huge archives boxes of handwritten letters from Dr. Albert Schweitzer to Dr. Gerson over those 35, 40 years he was in the Congo doing his Nobel work. That's how much of a relationship those two had, and how grateful Albert Schweitzer was for Dr. Gerson and his life. And so, by the way, for those of you who don't know, the other title that Dr. Albert Schweitzer is always associated with is the greatest Christian of his generation. And so I'm going to read for you here Dr. Schweitzer's eulogy upon hearing about Dr. Gerson's death, because they were supposed to meet up in Europe. They hadn't seen each other in a while. And Dr. Gerson had just written him, telling him he was going to be in Europe and hoping that they could meet up and see each other once again, because again, they were such close friends, and they never got that chance. So this is it. Again, this is also in the book Censored for Curing Cancer, but it is Dr. Schweitzer's eulogy to Dr. Gerson. And it's written to Dr. Gerson's wife, Margaret, and it was from the Lambarene, Gabon, in the French Equatorial Africa, the French Congo, March 10th, 1959. He said, "Dear Mrs. Gerson, a little while ago your husband wrote me that he would like to see me again and that I should let him know when I would be in Europe. Gladly I made a note of this, for I too had the desire to sit down again with him quietly. And now he has passed away." And it's exclamated, as you can see that you can probably imagine the pain that Schweitzer had felt. I was moved that you sent me a cable as if I belonged to the family. How I take part in the loss you suffer, you know, and that I mourn a friend in the departed, whom I counted among my closest, you also know. I owe him such gratitude for all that he did for my wife. Without him, she would have died when our child was small. How gratefully she has always thought of him. But in the hour when I received the news of his death, I also thought about what he's meant to the world. I see in him one of the most eminent medical geniuses in the history of medicine. He possessed something elemental. Out of the deepest thought about the nature of disease and the process of healing, he came to walk along new paths with great success. Unfortunately, he could not engage in scientific research or teach. This was the censorship. Even back then in 1959, they had complete control over what he could get out to the general public. So unfortunately, he could not engage in scientific research or teach, and he was greatly impeded by adverse political conditions, as we are today. In ordinary times, he would have been able to expound his ideas for many years as professor at one of the important German universities, would have taught pupils who could carry on his research and teachings, would have found recognition and encouragement, and all of this was denied him, and it continues to be denied of him. His was the hard lot of searching and working as an uprooted immigrant, to be challenged and to stand as a fighter. We who knew and understood him admired him for working his way out of discouragement again and again, and for undertaking to conquer the obstacles. Many of his basic ideas have been adopted without having his name connected with them, and that's true. Many are doing aspects of Dr. Gerson's therapy, but they don't even attribute what they're doing to Dr. Gerson's work. They take the credit for themselves. I've never done that, and I never will, because Dr. Gerson is worthy of that legacy. Many of his basic ideas have been adopted without having his name connected with them. Yet he has achieved more than seemed possible under these adverse circumstances. He leaves a legacy which commands attention and which will assure him his due place. Those he cured will now attest to the truth of his ideas. I hope that he also gains some pupils in the new world who will do this for him. We're trying, and we're being censored just like he was. We who knew and valued him mourn him already today as a medical genius who walked among us, and as a man who was destined to be a fighter, who proved himself in this adverse fate. With loving thoughts, your devoted Albert Schweitzer. So there you go. Bible says in the last days, evil will be called good, good will be called evil. That time has definitely arrived. If it has ever arrived before, the time certainly would be now. And so, again, it's unfortunate, but it's only the beginning, and it's only going to get worse. We thought COVID-19 was really bad. It's going to look like a walk in the park with what's coming. And so please, anyone out there, if there's any suggestions, and I know about Rumble and TikTok and all these other things, but really the reality is those social media platforms aren't to really get a message like this out. And Rumble, it's great, but it has such a small following compared to where everybody's really getting their info, which is YouTube and Google, right? So if there's any alternative ways that you can get it out, please let me know. Finally, in closing, if you know anyone who's suffering from any disease, whether it's cancer, diabetes, heart disease, autoimmune conditions, the Gerson therapy can certainly help them. So even though we've shut down our clinical operations, we still are able to help people with our 3-month home program. Feel free to visit our website, www.gersonclinic.com. We also have our store, which is gersonclinics.com, or you can also access it off of our website. And you can always contact me directly at director@gersonclinic.com. And there's other ways of contacting us on our website. But all is not lost. We've just taken a little more low-profile approach to what we're doing with the 3-month home program. But we're still here to help people if they need it. And feel free to reach out and contact us at any time, and we'll answer your questions, and hopefully we can help you. So thank you for listening, and unfortunate things are taking place, in this world today, but we have to try to get around it. So again, thank you for listening, and best of health.